Good afternoon and good evening, everyone. I'm Joe Pugliese, the President and CEO of the Hemophilia Alliance. It's my pleasure to welcome you to our first 2021 Harmony in Hemophilia. But before we get started, and I really hate to have to do this once again, but given the tragic shootings in Atlanta and now in Boulder, Colorado, in addition to some of the other general chaos, I thought it would be best if we started this evening with a moment of silence. You know, it's so ironic that after getting through the worst year many of us have ever had, and you can feel kind of the excitement building that in the not too distant future we're going to be able to get together in person. We can only hope and pray that we can find a way to be nicer to each other. So on that cheery note, I just want to talk to you a little bit about the Hemophilia Alliance and our mission and what we're doing to fulfill that mission. The Hemophilia Alliance works to ensure member hemophilia treatment centers have the expertise, resources, and public support to sustain their integrated clinical and pharmacy services for individuals with bleeding and clotting disorders. Never has it been more challenging for the HTCs to have the resources they need, particularly the financial resources they need to continue to provide the outstanding care they give to the community. The Alliance is led by a board of directors, which includes Heidi Lane, who's our new chair this year. She's a physical therapist at the Intermountain Healthcare System in Utah. Eric Gray is the vice chair. He's the CFO at Indiana Hemostasis and Thrombosis. Stephen Powell is our treasurer. He's at the University of Colorado Hemophilia Treatment Center in Denver. And Ralph Woods is the secretary, and he manages the Factor program Adversity, better known as the Blood Center of Wisconsin. Not going to introduce everybody on the board, but all of our board members have much experience, long experience, deep experience in the hemophilia community, and they all work at federally funded hemophilia treatment centers. What is the Hemophilia Alliance? Well, we thought we would do a pop quiz by way of a survey. So is the Hemophilia Alliance a group purchasing organization? Is the Hemophilia Alliance an advocacy education organization? Are they a payer relations and solutions organization? Are they a charitable organization? Or are they all of the above? Pick whichever one you think is most appropriate. I hope everyone is making some plans to be safe and well for the upcoming Easter holiday. How is the polling going, Sean?
It's going very well. We've got over 80% respondents already and still voting.
Okay, well, let's wait for those other 20%.
And I'm going to close it now so we can continue to move on.
%96%. All of the above. Very good. And I'm going to tell you how it is that we're all of those things. As we get to the next slide. Okay, the Hemophilia Alliance is a member organization. It was created in 1999 as a 501c6, which is by tax definition a trade organization. The Alliance was formed to help with that notion of that mission that I just talked about. In 2005, the idea was that they could form a group purchasing organization to leverage the purchases that they make on behalf of patients across the country to get better pricing, better terms, and to make sure that we had funds to fund the hemophilia treatment centers. Both the 501c6 and the 501c3 are not-for-profits, but in 2008, we merged the two organizations. So the Hemophilia Alliance and the GPO merged to form one 501c3 not-for-profit. They asked me to serve as the president. As I mentioned earlier, the board of directors are all HTC employees, and the mission remains the same. Right. By by pooling our purchasing power, we're able to get better pricing, better discounts. And in 2020, we were pleased to help, on average, each member save $943,000 versus what they would have spent without the contracts that the Hemophilia Alliance was able to negotiate. Manufacturers pay what is called an administrative fee to the GPO. If you think about it, it's easier to contract with a single entity like the Hemophilia Alliance than to try to go out and contract with 107 treatment centers around the country. We also help those manufacturing partners with having better access to our membership. And it gives them the opportunity to let all of the HTCs know that they're out there supporting their mission in a very tangible way. The Alliance uses those admin fees to provide services for members of the HTC members and to provide charitable funding to the broader community. When I first started this adventure in 2006, many people in the community were anxious that this wouldn't work as well as it has. And I'm delighted to say that we've been able to fulfill our promise that to the extent that we're successful, we reinvest back into the community. And I'll tell you why in a minute, or tell you how in a minute. The Hemophilia Alliance is an advocacy and education organization. We run an annual Hill Day, which is coming up on, I believe, May 5th this year. Our lobbyists, Joanna Gray and Ellen Riker, who are known to all of you, are really the voice of hemophilia in Washington, D.C. They've been the longtime lobbyists for the National Hemophilia Foundation. They also represent the American Society of Hematology. We provide support to the local HTCs for their advocacy efforts, and we provide 340B programming assistance, particularly around regulatory and compliance issues related to being a federal grantee. It's not easy being a federal grantee, all right? And a huge win in 2020, and what I really like about this is I think this is a tremendous community win, is after years of trying, we finally got passage of the skilled nursing facility legislation. So starting October of 2021, Medicare bleeding disorder patients who need rehab will have their factor concentrates, their therapies reimbursed while they're in rehab in a skilled nursing facility, something that we've been trying to get done for years. And in what's been probably the most challenging year ever, we got it done, which is quite an accomplishment. Hemophilia Alliance is also a payer relations organization, headed up by our Senior Vice President of Payer Relations, Jeff Blake. The HA payer relations teams work with brokers, consultants, payers, and pharmacies, as well as PBMs to help individual patients get approved for your HTC pharmacy so you can support your local HTC. Help HTCs remain in network with payers, including PBMs, and help HTCs who are out of network become in network with all payers and PBMs. And this doesn't just help the HTCs, this helps the entire community. And let me give you a quick example. There was one employer out there, a self-funded employer, who somehow wound up with 3 people with hemophilia working for them, and they only had about 1,000 employees. So I would say that that was statistically unlikely. And it wasn't even like they all worked in the same location. They were spread out across the country. And to this employer's credit, they wanted to continue supporting these 3 people with bleeding disorders. But since you all know the annual expense of hemophilia, you can imagine for a small employer with only 1,000 employees trying to support 3 people with hemophilia can be a financial strain. Working with the payer relations group at the Hemophilia Alliance, we were able to reduce the annual cost of care for each of those patients by about 25%. They were able to stay at the same HTC. They were able to stay on the same product and continue to get the outstanding clinical service and the support of their employees. A national pharmacy and distribution hub via the Alliance Pharmacy. Many of you know Vincent Pissarro and his wife, Mary Ann. Vinny is a severe factor IX deficient patient and has been the president and CEO of what used to be Positudes and is now the Alliance Pharmacy. It's an independent, not-for-profit 501c3 founded in 2000. It's licensed as a pharmacy in all 50 states. It's licensed as a wholesale distributor. They manage the STIMate trial program prior to the recall. And the board of directors consists of HTC pharmacists and individuals from within the hemophilia community. We're a charitable organization. The Hemophilia Alliance Foundation is an independent nonprofit entity founded in 2013. The Hemophilia Alliance provides funds to the Hemophilia Alliance Foundation. And I think it's important to note that the Alliance Pharmacy also provides funds to the Hemophilia Alliance Foundation. And the Hemophilia Alliance Foundation provides grants to HTCs and chapters across the country. The board of directors is comprised of a cross-section of the bleeding disorders community. And that organization has grown since its founding in 2013. Just to give you an idea of the kind of support we've been able to give to the community most recently, in 2018, we gave support of $2.2 million to Athens NHF patient assistance funds, and 600,000 of that came out of the Hemophilia Alliance Foundation. In 2019, again, it was about 2.2 million, 749,000 came out of the Hemophilia Alliance Foundation. The rest of it went from the Alliance to the organizations listed above there. And in 2020, when I think people really needed it most, we were really able to pick up our game, and we donated either directly or through the Hemophilia Alliance Foundation in excess of $3 million. And we continue to look for ways to invest back into the community. So community support since 2010, $16 million. And we want to do more, but we can only do more with your support. And now to put just a little bit of pressure on myself, as you know, STIMate was withdrawn from the market in, I believe, July or August of last year. And I think all of us kind of thought, well, it'll be back pretty soon. Then in, I think, December, Ferring announced that they would not have the product available until the end of 2023. So 3 years without this critical product for VWD patients, for mild to moderate hemophilia patients. And with the help of many people from treatment centers, from the Alliance Pharmacy, the Alliance Board, we've been doing our homework. And on Monday of last week, on Friday of last week, we signed a memorandum of understanding with a 503B, which is a compound manufacturer who has the ability in times of shortage to manufacture FDA-approved products. We hope to have the first doses of DDAVP intranasal available, I'll say 90 days from today. And I think it's important to know that in keeping with investing in the community, the Hemophilia Alliance is covering all of the upfront development costs to expedite the delivery of this product back to the community, and the product will be distributed through the Alliance Pharmacy. So you see how all of these things tie back together. I hope that's my last slide. Well, except for the thank you. So Karan, I took more time than I intended, but it's all good information. And so it's now my pleasure to introduce to you the creator of Harmony and Hemophilia, our own Director of Community Relations, Karan Bowe. Karan, it's all yours.
Thanks so much, Joe. And, you know, you always have such great information, and I think it's really important for this group to hear. Sean, I just wanted to ask, were there any questions?
No, there wasn't, but let me remind everybody about how to ask questions. Thank you, Karan. If you have a question, would you please click on the control panel that is in the upper right-hand corner of your screen. Click on the questions tab, which is about halfway down, and you can type your questions in there. Then we'll read it out to our presenters and get an answer for you. Again, the control panel in the upper right-hand corner of your screen, click on the questions tab. Thank you, Karan.
Thank you so much, Sean. And again, thank you, Joe. And thank you to everyone that took the time to join us this evening. I hope you will find what we have presented already, as well as what we plan to present, useful to you and in your community. Right now, I would like to turn this over to Elizabeth Karan, better known to us as Issy. Issy is our legal counsel for the Hemophilia Alliance, and she is going to talk about the 340B discount program. And Issy, I turn it over to you, and thank you so much for joining us this evening.
Thanks, Karan. And thanks to everybody on the call. I know you could be a lot of places, so it means a lot that you're joining us here tonight. So just to start off, let me say that I'm a lawyer, but I have to disclaim all of my presentations and tell you that this is not legal advice. If you need a lawyer, get in touch with a lawyer. This is intended to be educational, and it's really just my opinion. And Sean, I think that Joe covered the first part of my slide deck, so if you just want to skip forward to slide 7, that'd be great. So my hope tonight is to give you all a little bit of understanding about the structure that HTCs operate under, and specifically how the 340B program works. So if we go to the next slide, you will see a little graphic of the structure of the HTC program. And I looked it up tonight. So HTCs are federal grantees. So Congress allocates money to different departments, and then those departments put out our requests for application, and they get responses back. In our world, the Health Resources and Services Administration is the overarching agency that oversees our grants. And what I looked up tonight was how much money the federal government has given out in grants. And in fiscal year 19, they gave out $720 billion in grants. So there's a lot of money going out the door from the federal government. What's interesting about our HTC structure, right, is that HHS gets the money, it then goes to HRSA, who then sends it down to the Maternal and Child Health Bureau. And then the Maternal and Child Health Bureau actually grants to 8 different entities across the country. So if we go to the next slide, you'll see our map. And from there, the money then gets allocated out to all of the other HTCs. So you'll see these are all the different breakdowns. You all might be in each region, but there's one HTC in each of these areas that gets the money straight from the government, who then grants it down to the center. And what's fascinating about our program is that it's tiny in the scheme of $720 billion. HTCs in total get about $4 million from the federal government, which works out to about $30,000 per center. So as you all know, hemophilia and other related bleeding and clotting disorders are pretty high cost disorders to take care of. We say about annually $250,000 for routine costs. So our grant program really can only is a pittance of the cost that an HTC incurs to provide comprehensive care. So this is where the 340B program becomes so vital for our HTCs. The receipt of that grant funds from the federal government makes them then eligible to participate in the 340B program. And then any of those funds generated from getting discounted drugs gets to be rolled back into the comprehensive care model. So if we go to the next slide. All right, so this is where we get into the boring legal stuff. Federal grantees, upon taking money from the government, even money from a third party that was once the government's, they have to comply with a gajillion, what we call grant rules, the Uniform Grants Guidance. You'll see the citation up there at the top of the slide. Largely, this means that they are going to have to could be subject to audit. They have to do certain accounting practices. They have to make sure that they're competitive in their procurements. And then they also have to comply with a bunch of different principles when incurring expenses. So we can move through these slides pretty quickly, but first off, it has to be a type of fund that is allowable. It has to be reasonable, which is exactly what it sounds like. And it also has to be allocable. So it has to be clear that that is necessary to perform the services that are identified in the grant. If we go on to the next slide. So this is where we get into some more technical legal mumbo jumbo, but the grant rules have a term of art called program income. And essentially this definition just says that if you are generating these funds because you have a federal award, even though we, the government, have not handed you these funds, you have to spend them the same way you spend our money. So this is where 340B revenue comes in. So for our HTCs, they have to treat any funds that are generated from a 340B transaction just like they do any other funds. So that means it has to go back to the purposes of the grant, which is clearly stated as providing comprehensive care to people with bleeding and clotting disorders. They have to follow all those accounting rules and they have to follow all those principles for incurring expenses. So I wanted to start with just touching on the grant rules so that when we get into the 340B stuff, you understand that there's actually very little difference, none at all, for federal grantees between the revenue they generate from their factor programs and money they would just get right from the federal government. So next slide, please. All right, so what are some typical expenses? So the most common is paying for staff. So HTCs can use their grant funds, their federal funds to pay for staff. This can include staff that typically, we don't always get great reimbursement for. So that might be, your social worker that helps with some of the other things that aren't necessarily billable, but it also can include our physical therapists, our geneticists, our doctors, etc. Those funds can also be used to help, pay for supplies or other things needed for hemophilia patients. And there is a manual that I referenced a few places in here that was put out by the federal government, which describes in detail what HTCs can spend their 340B funds on. Next slide, please. All right. So again, this is a reference to that manual, and they're supposed to use any extra income from 340B discounts to expand supporting services and provide factor replacement to uninsured patients. So again, right there in the federal guidance, we find direction on what 340B funds need to be spent on. Next slide. Okay, now we get into the fun stuff. So if you're ever wondering what 340B means, what is that number letter situation? It's actually just a reference to the provision in the Public Health Service Act that the program comes from. So the program went into place in 1992. And what's interesting about 340B is that it allows and funds Sorry about that, guys. Technology. So it expands the safety net without the federal government having to put forward money. So this was the intent of the program. So you all may know how it works, but essentially, if you can go to the next slide, please, Sean. So the 340B program's purpose is to allow covered entities to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. So Congress's intent when they created this program was to make sure that safety net providers had the resources they needed so that they could do more for their patients. And as we touched on when we talked about the grants, without the 340B program, without the receipt of federal funds, there really wouldn't be the resources to provide comprehensive care to patients with bleeding and clotting disorders. Here's a list of the covered entities. So what's interesting about the program, so on one side of the slide, you see a bunch of different specialized clinics, which include our hemophilia treatment centers. And on the other side, you will see hospitals. So if you're ever reading news articles or hearing debate about 340B, keep in mind that all of the specialized clinics are federal grantees like we are, so have to comply with all those special rules for the program and make sure they're spending 340B funds pursuant to the purposes of the grant funding they have. Hospitals operate a little bit differently. So hospitals can spend their 340B funds on any site that's in their cost report. So I always want people to understand that we're all together in the program, but we operate under different rules when it comes to what actually happens with the 340B funds. Next slide, please. So there's an interrelationship between the 340B program and Medicaid. 340B came into place because it came into place the year after the Medicaid rebate program. So the discount in 340B is actually tied to the percentage of the Medicaid rebate, and they can be very substantial discounts. So we're talking somewhere between 25 and 50% off of the sticker price of regular drugs. And so then if the patient has insurance, the 340B covered entity can then bill the insurance what they normally would get reimbursed for that drug. And that's really where the 340B funds are generated from. But there is a close connection, and any drug that wants to be paid for in Medicaid has to participate. That company has to participate in 340B. So that carrot is really how we get folks, our manufacturing partners, to participate in the 340B program. Next slide,
I'm going to interrupt you for a moment while we move on to the next slide. Fernando from West Virginia asked a question, and that is, who's supposed to hold HTCs responsible when it comes to appropriately using program income as you detailed? Do you want to talk a little bit about the Office of Pharmacy Affairs?
Yeah, so there are a couple different organizations that oversee both the 340B program and grant expenditures. So when it comes to 340B, the Office of Pharmacy Affairs, also within HRSA, within HHS, is charged with making sure that 340B covered entities are complying with the 340B rules that we'll go over quickly here. Namely that the patients that receive the drugs are patients of the covered entity, and that the manufacturers aren't having to pay a Medicaid rebate on a drug that they've also paid a 340B discount. When it comes to compliance with grant rules itself, both the Maternal and Child Health Bureau and the regional grantees have a role to play in making sure that the HTCs comply with those requirements. And then there's also an Office of Integrity within HHS that has the authority to audit federal grantees should they fail to follow these rules.
In addition to that,
go ahead.
Sorry, I have one more. Could you just elaborate quickly, if you don't mind, on the slide where you reference program income can pay for factor replacement for uninsured patients?
Sure. So this gets very complicated, and we touch on this at the end of the presentation. So I don't want to tell you to hold your thought, but it can get tricky to provide anything of value to patients if you're a healthcare provider because of federal fraud and abuse laws. There's a rule called the Civil Monetary Penalties Act that prohibits healthcare entities from providing to Medicaid patients something of value that might induce them to use more services. All that being said, those rules all have exceptions for financial need. So if a patient is unable to pay for their product and the HTC can document that need, there is a way for us to compliantly make sure that that patient has the services and items that they need.
Thank you.
All right, let's go to the next slide. So diversion just basically says that you can only transfer a 340B drug to an eligible patient. And there's a very specific definition of eligible patient that will be on the next slide. And namely, that's just that you have to have provided them a healthcare service. You have to have a record of that healthcare service. That healthcare service has to be within the scope of your grant, and you have to have an appropriate relationship to the healthcare provider such that the covered entity is responsible for the care of the patient. So 340B covered entities can't just hand out drugs to other entities or to someone that they don't have a relationship with. And then the other rule in the 340B program I already mentioned is that manufacturers don't have to pay both a front-end discount to a 340B covered entity and a back-end rebate to a Medicaid program. So in fee-for-service Medicaid, we have clear rules about how we're supposed to figure that out, but it is the covered entity responsibility to make sure that that doesn't happen in fee-for-service Medicaid. Managed Medicaid gets a little different. And then as I referenced, the Office of Pharmacy Affairs oversees the program. They also maintain a website called the OPA Information System. It lists every covered entity, every site they have, and every relationship they have with a contract pharmacy. And then if we go to the next slide, again, audits are, HTCs can be subject to audits by OPA. We've had a couple go through and they did very well. But those audit results are also posted online, but they audit for those compliance requirements that I mentioned earlier. And then finally, next slide. All right, so here's why. I just want to make sure you all understand that HTCs can't just hand out their 340B drugs or other items to patients. On the next slide, you'll see I oversimplify it here, but mainly any time a healthcare provider either gives a patient or another healthcare provider something of value, we can run up against federal fraud rules. The slide after this includes the specific law language around what we call the beneficiary inducement prohibition. And remuneration, it's really, really broad. So it really can be anything. The next slide actually identifies some of the important exceptions to these rules, but they have to be highly structured to fit within these exceptions. So again, it's a pretty tedious process, but there are ways to figure this out for patients. But an HTC and an organization has to really do the legwork and the compliance work behind those. So I'll stop there. My contact information is on the slide. I'm always happy to speak with folks. And thank you so much for your time and your wonderful questions.
Izzy, can I just, we've got two good ones. I think you can quickly answer them. Steve has asked, what is the definition of a relationship? Is it just a once-a-year visit, or is it full-on care provision year-round?
Yeah, so a comprehensive care visit is sufficient from a 340B perspective. There is no specific time frame or time lag between when a visit has to occur and when it can be in the 340B program, but it has to be the healthcare service that generates the prescription that the covered entity wants to include in the program.
And Shalini from CIBD has asked, or has stated, my understanding is that program income means gross income earned by the non-federal entity that is directly generated by a supported activity or earned as a result of the federal award during the period of performance. What activities would you define as a result of the federal award? Would that only refer to the sale of factor?
No, it doesn't only refer to the sale of factor. MCHB has made very clear that factor replacement programs definitely generate program income, but this could also include reimbursements related to the activities of the grant, or that's the other really common example. So yes, it's really any activity. You're right. That's 100% correct.
And Stu Lurch from Hemophilia Foundation of Michigan just wanted to point out and remind you that the regions also have oversight of the HTCs and work closely with MCHB. And I know you skimmed over a little bit, but I know that's, you can certainly touch on that.
Yeah, definitely. So I think someone asked the question earlier, who's in charge of enforcing the grant rules? And that's, again, 100% the government and the prime grantees, which is the region. Hi, Sue.
And that's it. I've got a question from Tracy Gasolin, and Tracy, I'll answer that directly with you. I'll probably give you a call tomorrow to answer that if that's okay. Thanks so much, Izzy. And Karen, back to you. Oh, you're muted, Karen. Oh, hold on. Let me get you up. Why? Let's try that again. Can you unmute?
And there we go. Technology, you gotta love it. So, Itzi, thank you so much for a great presentation. I just want to let everybody know that we're going to be sending out a survey after this presentation, or perhaps sometime tomorrow, to all of the attendees tonight, where you will have the opportunity to let us know if you would like to have more information on the 340B program, and where we can go into more depth if that is something that would be helpful to the attendees on this program. At this time, I would like to introduce Bob Robinson. Bob is the Executive Director of the Bleeding Disorders Alliance of Illinois, and Bob is going to be talking about collaboration and program development with two of the HTCs in Here's area in Chicago, Rush and Bleeding and Clotting Disorders Institute. So, Bob, thank you so much for joining us tonight, and it is all yours.
Thank you for inviting me, Karen. So recently, Karen and the Alliance introduced the Harmony in Hemophilia initiative that the Alliance and the Alliance Foundation is going to start with the Hemophilia Walk, the Unite Walk this year, and I was especially excited to hear about it, and wanted to share with everybody something we were doing in Illinois. So could you go back to that last slide? So back one slide, please. So when I would, it got me triggered to think about how we work in Illinois. So we have 5 treatment centers in Illinois, and we work together with all of the treatment centers, but we work very closely with both Rush and the Bleeding and Clotting Disorders Institute. And when I think about our work together, one of the things that makes us work together is we start from our vision, from a common vision, which is our mission. And if you look at our mission, we're all working to make a better life for people with bleeding disorders. So, and I just thought that I'd put in front of everybody our separate missions, but they look very similar. So there's a common vision. So the next slide. So, as I said, we work together, and we've had a strong collaborative partnership for quite some time, and we do a lot of stuff together. We do educational programs. The teams at Rush and at BCDI provide speakers, and we speak at their events. We promote the ideals. One of the key messages at BDAI is that HTCs and the principle of the HTC is critical. We do not put anything out at BDAI without saying to everybody is the message that you as a person with an inherited bleeding disorder should be seen at an HTC at least once a year, and we include, you know, what it means to be seen at an HTC. And if you're not being treated at an HTC, we're recommending, you know, that the importance of, we don't try to take you away from your primary hematologist, but we try to get you to that comprehensive visit. On the flip side, there is the BCDI and Rush are sharing with patients the value of being involved in the BDAI community also. So Camp Warren Church, which has been a camp, one of the oldest camps in the United States, both of the centers are very collaborative. They send staff there. They help us with the policies. They help with the programs. And it's important to say that Dr. Baggio has been a standout. She has been the medical director for the camp for a very long time, and she has been coming to camp and spending the entire time at camp except for last year, which because of COVID, we've had a virtual camp, but she's been coming to camp for the past more than 15 years. We were trying to figure out today, and I don't know if Dr. Baggio is on, but at least 17 years, but I'm probably going to be in trouble. But putting a lot of nights in a camp. So, and we really appreciate both the centers and everything they do, but Lisa has done a lot. So the Advocacy Partnerships is we work, I can't tell you everything that we do on the systemic levels. We've changed Medicaid rules. We've recently, in the last 2 to 3 years, Dr. Tarantino and I went to the governor's office, and it wasn't our bill, but it was Nord's bill, but we went right to the governor's office and met with a key representative of the governor's office and got the Rare Disease Act legislation signed by the governor. And the bleeding disorders community is the one that got it over the finish line, and got Dr. Tarantino on that commission. So, and we're getting it working now. So there's been key stuff that we're doing. And then it's as important there is that we don't just work at the systemic level together. Where it's appropriate, we work to help individual patients, and especially in these day and age, where you need to help with all these insurance issues. We never violate HIPAA, but there are times that we really do need to help and work through individual issues. Financial assistance, especially over the last year with COVID. And then, which was triggered with looking at this harmony in hemophilia. We work on both sides. Dr. Tarantino's center is a unique center in that it's not in a hospital. It's a freestanding clinic, and it's actually a 501c3. So I've helped there with some fundraising, but really, when we talk about fundraising, Rush and BCDI have always been there. And really, the individuals of Lisa and Mike, they have always been really strong partners. They've been there to help BDAI. So we've done a lot of really good fundraising together. On to the next slide, please. So as everybody knows, pretty much March 12th was a really unique day. So you can't see really what's below the graphs, but before March 12th, that was our budget. And after March 12th, what really occurred was the light blue was our fundraising events budget, and it all went away. So we were faced with about $150,000 worth of our budget after March 12th that we had no idea where we were going to get it. And it really wasn't even the first critical moment. We were faced with a few months of really what we were going to do with programming, how we were going to face with the crisis of our community, how we're going to face with the community, getting all the word out about COVID. So we spent the first 3 months just pivoting around COVID. So really about June, we needed to get started with fundraising. And thank God we have a strong community. And we started in June, really centering all of our fundraising around our walk, and really put all our eggs in one basket and begin to put a really aggressive fundraising program together around a virtual walk. And as usual, we looked at every creative way, and I went to that strong partnership with Rush and BCDI and said to Dr. Tarantino and to Dr. Baggio, will you do something special? So can you go to the next slide, please? So what we did is we created a challenge called the Factor Cup. So, and what I did was take Dr. Tarantino and Dr. Baggio are both very good sports, and they're very collegial, but they're also very competitive. So at the time, Lisa was working on she was working very, very hard. Rush was very, very inundated with the COVID crisis, and Lisa and I have been friends for almost 30 years, and so we were talking quite a bit because she was very emotionally tired, so I was checking in with her quite a bit. And what she was talking about is that when she was getting home from the hospital at night, she was riding this POC bike, and I'll tell you in a little bit what a POC bike. And she was really riding her POC bike because she needed to mentally come down from all of the cases that she was faced with and all of the mental strain that she was needing with all of the time she was spending in the COVID wards. And what she was finding is that she was seeing a lot of personal results to her health. And I was saying, wow, why don't we do a challenge to Dr. Tarantino? And why don't you say, challenge Dr. Tarantino, because we both know Dr. Tarantino rides his bike a lot. So why don't you challenge Dr. Tarantino for 2 weeks, see if he can ride 300 miles, and whoever can ride 300 miles and get pledges, whoever gets the most pledges for those miles will get the Factor Cup. And that Factor Cup, then this year they'll get the Factor Cup, and then we'll have the Factor Cup each year. We'll compete for the Factor Cup, so you just don't get it and keep it forever. It'll move from center to center. So, and then the idea was hopefully we'll get more centers in it the next year. So we created this, and we created this little thing, and we put a phone call together, and she kind of teasingly challenged Dr. Dr. T, and that her POC, which is her piece of crap bike, which is just an indoor stationary bike, she challenged Mike to ride the bike. And so if you go to the next slide, so they, and Sean, if you will, they rode for 2 weeks. And it just, and we promoted it, and I'll just play.
Bob, unfortunately, I can't play the slide the way it's set up. No, but what we will do when we send out your slide deck, we'll make sure it's embedded in there. So
it is really worthwhile because it just is, it goes really to show two, it really shows the collaboration, because what Dr. T and what Dr. Baggio said is just so moving. But we had a goal of raising $60,000. We raised $65,492, which for a COVID year was just, and I think Katie Cooper's getting on from NHF can collaborate or can chime in, just was how wonderful it was for Illinois. It was just great. Dr. T rode 287 miles. Dr. Baggio on her POC bike rode 305 miles. So Dr. Baggio won the 2020 Factor Cup. The total raised between Dr. T's bicycologist and Russia's HTC Mad Infusers was $3,145, which was new money to the walk. And so, and the other thing is just, again, was awareness. And there is the actual Factor Cup. And I have to say, if you look at the dollars spent, it looks beautiful, but it was $39 is all that award was, because I also went to my award company and said, we don't know if we're going to spend, how much we're going to make. And she said, this looks nice, but it's cheap. So our next step, as I said, was to take this out to the other centers and get them involved and make it any kind of thing. But we are looking now to fold this in and work with Karan and do something with the Hemophilia Alliance and this program. So thank you for letting me share.
Bob, thank you very much for that. I'm going to turn this back over to Karan in a moment. One of the questions that did come up is, who donated to the doctors?
It was their personal friends, their families, their patients, and their centers and their staff. They went out and did that all. They did that all on their own. And they did Facebook fundraisers. They did that all. It was nice because it was again another stretch. It wasn't like it was our networks. It was a whole other, it was an expansion of our systems.
Thank you so much. Karan, as you know, we're coming up to the end of the hour, and we still have a few more presenters. I imagine we will continue with the presentation and hope that you, our audience, can stay with us for a little bit longer. I think there's some very good information coming up. In addition to Glen Roy from Maine, we also have Katie Cooper from National Hemophilia Foundation, and Karan is going to wrap up the evening with just a quick few slides. So we will continue along. Thank you so much, Bob. And Karan, back to you.
Karan, I do have a board meeting, so I'm going to, I will, anybody who has questions for me, please let me know whatever I can add, and I really appreciate this opportunity.
And Bob, thank you so much for joining us. We definitely appreciate it.
Thank you very much.
Great presentation. Appreciate it.
Thank you. Appreciate it. Thanks. And I'm here to help, whatever I can do with this.
Thank you. Right now, I'd like to present Glen, who is the nurse coordinator at Maine Hemophilia and Thrombosis Center. He'll be joined by Louise Baca, the Senior Director for Oncology, and Glen's going to talk a little bit about their programs that they've developed in collaboration with Hemophilia Alliance of Maine, as well as New England Hemophilia Alliance.
Great.
And
Thanks, Karen.
turning it over to you guys.
All right. Can you hear me?
We can.
Perfect. I just wanted to say first, on behalf of the Maine Hemophilia Treatment Center, Glen and myself, I want to thank the Hemophilia Alliance for inviting us to present tonight. This is a wonderful opportunity, and there's been lots of great information shared with us. I only want to say a couple of things as an intro. Glen will be giving the presentation this evening, as Glen is the heart and soul of the Maine Hemophilia Treatment Center. He began many years ago and has really developed and expanded and grown the center in leaps and bounds, and actually was the one that started the 340B program years ago. What we're going to focus on tonight, as you can imagine, we have many initiatives that we collaborate with many stakeholders throughout the state as well as outside of the state. But the couple that we're going to focus on tonight are the collaborative relationships with the Hemophilia Alliance of Maine and the Hemophilia Alliance. And we just wanted to start off with a couple of pictures. This is sort of a representation of our annual summer camp that we have for our bleeding disorder families that has been in existence for many years, and it also highlights the Winterfest activity that we have for our bleeding disorder families. So if you just want to go to the next slide, this is really a depiction of our summer camp that we have, and as you can see, it is a very popular event that lasts 5 to 7 days, 1 week during the summer. And as you can imagine, it takes a lot of collaboration with many people. And now I'll just hand it over to Glen, and he can share and sort of dissect the nuances of what it takes to have successful events such as these. Thank you very much.
Thank you, Louise.
Go to the next slide.
Thank you to the Hemophilia Alliance too for inviting us to do this. And it's hard to do these presentations and not see all our faces, but I say hi to my friends and colleagues, and we look forward to hopefully getting in person later this year or next year during these times. The New England Hemophilia Center, we've worked with them since basically when I started camp in 1993. And they help provide quality of life for all persons with bleeding disorders and family education through the support through all the states of New England. And then the Hemophilia Alliance became a chapter started by some moms in the state of Maine about 10 years ago, our national chapter of the NHF, just like New England Hemophilia. And so they focus on, their mission is just for the families in New England, but there is collaboration between the two organizations to help the families in Maine. And so with NEHA, our big program that I'll discuss is the family camp, as Louise said, and the Hemophilia Alliance has a Winterfest program that they started 7 years ago that we collaborated on. But as I was sitting here tonight, I thought of the book, a memory book of the 20 years of camp, which we started camp in 93, and now we're going to be on our 28th camp, or 29th this year. Last year, we actually had to do it virtually. And when we started camp in 1993, it was a trial getting families together. So mostly from Maine, a couple from New Hampshire, and I think one from Mass. I think we had like 9 to 12 families the first year. And it has grown to 80 families participating a year. And even virtually last year, families who do not like, going to a camp really enjoyed the virtual component, and they got to experience that. So we were able to keep camp going. And this year we're, looking to have it, some of it in person, hopefully, but it may have to still be virtual. But I think what the value of these programs, if they were giving me a book at the 20th camp and fond memories, and I just want to read one or two of these quotes, and I'm just going to highlight them. One gentleman who's now a counselor said, all of the fond memories that I shared with great friends and that I made along the way, I really enjoyed. I started attending camp with my family when it was located at Camp Mechawana in Maine when I was 15. And I began volunteering as a counselor, and I continued to volunteer into my college years. Each year it was the highlight of my summer. It was incredibly inspiring to be part of the self-infusion classes, and the bonds I formed with my fellow counselors still hold strong to this day. And then, from a parent perspective, it was the friendships that last a lifetime, and then watching the children grow through life and into their teenager years and becoming adults. And so that has been, these families have often stayed together and networked for many, many years. So our shared vision really of Winterfest and Family Camp is for people of all ages to connect with each other, feel understood, experience fun, and educate in a safe and supportive environment. So we hold self-infusion schools, and then we really try to teach children with their bleeding disorders how to take control of their conditions, and in the case of learning how to, if they're on factor, how to infuse that independently. So that's what our shared vision mission is. Communication has been very key, that we connect in with the leaders of New England Hemophilia and Hemophilia Alliance of Maine. And then we serve, working together, multidisciplinary team that involves, planning committees and setting up camp and Winterfest. Our resources for internal and external support, you can imagine that when we do these events that can last either a weekend event like Hemophilia Alliance of Maine or Family Camp that's for many days, you're going to have a lot of different activities for the families, so which could include arts and crafts and stuff. So a lot of the arts and crafts and everything are really considered in kind and are donated. And when we do things like self-infusion classes, we'll provide the medical in-kind supplies to do the infusion classes. That could be saline flushes, all the butterfly needles, and everything medically that you need to do that. The monetary money that we that I wanted to share in this is that we use our 340B funding to help support the funding of both the Winterfest and the Hemophilia camp. And then New England Hemophilia and HEM, they both have their fundraising to help fund camp too. But we as a center use 340B money, and we have agreements with them, and we contribute that money to both organizations to help support both programs. The human resources really is, we at our center provide nurses for the self-infusion classes at both programs. We've also done educational programs like discussions on transition from a young teenager through adulthood. We've done programs on sports and hemophilia and other bleeding disorders. So we help provide all the staff, but we also, just so you know, collaborate with the other HTCs to help provide staff when it comes to family camp. So we have nurses from the different centers in New England that help support the infusion classes, and we run a medical office, first aid office throughout the camp. The process and planning includes, well, for family camp, we start planning each camp in January. Neha, Rich, and now Sarah, they both the leaders of NEHA help plan this planning committee, and we have monthly, well, probably every 2-week meetings and monthly meetings. Right now, things have been a little bit different because we're still trying to determine if we're going to have it virtual or in person, but we will be ramping up things come May. But so I am the medical leader for the planning and coordinating, getting all the nurses for camp and for running the medical office at camp. And then with the Hemophilia Alliance of Maine and Winterfest, when we plan, we have several meetings months in advance, and we plan self-infusion classes and some other educational events. And then the flexibility is that we have been able to, adapt to the needs, especially during the pandemic, of not being able to have the camp or Winterfest in person, but we collaborated with NEHA and HAM virtually to help, with these programs. So we help provide a medical talk on transition for both of those programs this year. While it was very neat to see NEHA do great work and Winterfest doing all their other programs that they did virtually, usually about one a week for about a month or so. So it still had the feel of a camp and a Winterfest. And then the other things I was going to just say is that we just really all work together as a team. And we can go back to our shared vision and mission. And thank you for sharing that, Sean. But that's our goal, is to make everyone feel understood, experience fun, and education in a safe and very supportive environment. Louise, do you have anything you want to add?
No, you did great, Glenn. And as I'm sure everybody can appreciate, it takes a village. And, to have something such as Winterfest or Family Camp be so successful to the point that every year, the number of registrants keep increasing, it's just a testament to the value of things like this, and a testament to the value of collaborations with organizations like Hemophilia Alliance of Maine, and NEHA. I mean, it's just, I experienced last year summer camp and with Winterfest, not last year, but the year before, personally, and was really amazed at how well run and enjoyable and beneficial it was to all of the families. So we're absolutely willing to share with any treatment centers that have not gone down that path yet. And, we would love to share all of our knowledge and how we did this in a collaborative manner. Thank you.
Yeah, I guess I can reinforce, because some people really worry about how much, can you spend money to help support these programs? Well, that's the mission of 340B, is to stretch scarce federal dollars, but also use those 340B resources to provide and give back to the families and provide the education they need. And that's what Izzy was, mentioning in one of her slides.
Thank you, everyone.
Thank you, Louise and Glenn. This has been really educational, and thank you so much for sharing. And Glenn, I love the spring flowers in Maine going up behind you. It's wonderful. I know you said it was 60 degrees there yesterday, and I'm very happy for you that you're getting some warm weather.
Yeah, we're 20 to 30 degrees above average right now. We're trying to enjoy it.
Well, a lot of it, I'm sure, has to do with your warm personality. So thank you so much again for presenting.
Yes.
Thank you.
Thanks again. Second what Sean is saying. Thanks so much. We appreciate the effort that you put into this and the effort that you put into your program.
Well, thanks. I have to say, Louise has been a really great colleague to work with the last 3 years and given us a lot of support. As you remember, years ago, I was the only person, and now I have a
You
lot
were
of
it.
staff, including
Yeah.
Louise. But I have a nurse practitioner, 3 other nurses, a social worker, and we're expanding to a genetic counselor, offering those services. We're just expanding, and that is really the benefit of a 340B program.
Great point, Glenn. Thank you so much. Appreciate it. And I know we've run over, but I just want to introduce Katie Cooper, who will talk a little bit about the Unite Walk program, and then I will end the evening talking a little bit about our Harmony and Hemophilia HTC challenge. So, Katie.
Katie, before you get started, I know you were going to run your slides. Do you mind if I run them just to be a little bit more efficient at the moment?
Nope, not at all.
Thank you.
Awesome. Thank you so much, Karan, for the warm welcome. And I also just wanted to take a moment to thank the Hemophilia Alliance for their support endlessly over the years, especially now that you've come on board with the WALK program and have created an opportunity for us to get creative in how we serve our chapter network and leverage our relationships with our HTC partners to create connections at the local level. So just wanted to thank you for that partnership. And Sean, we can move to the next slide. And I'm gonna, knowing that we're over, I'm gonna kind of take the 2 high points from each of my slides so we can get to the real magic of tonight, which is Karan sharing some of the vision of that Hemophilia Treatment Center challenge. But the walk has been around for a number of years, and in 2017, we rebranded to really reflect the community that we serve. And knowing that we have a diverse audience tonight in both HTC staff as well as our chapter partners in the field, as well as some NHF staff, we just wanted to give a super brief high-level history. So that rebrand happened about 4 years ago. We're going into our 5th season as the Unite for Bleeding Disorders WALK program. At that time, our focus locally was to really diversify revenue and create that sense of community through the WALK. At that point, we added some more nationally branded elements that can really help still maintain that local feel, but connect that to that nationwide movement of supporting the bleeding disorders community. So thinking about things like that pinwheel mission moment and the fundraising clubs and some of those things that are really similar across the board. Next slide, please. So when we were approached by the Alliance in terms of connecting with the WALK program, we really wanted to lean into the whole idea of the Harmony and Hemophilia Project and their commitment to creating really strong working relationships between our hemophilia treatment centers and our local affiliate chapters, knowing that that's going to create the best atmosphere to serve our bleeding disorders community. So this all kind of started with a little nugget of idea sharing and just brainstorming and lots of powwows with Sean and Karan and the rest of the team. But we wanted to take a moment to reflect and celebrate the amazing support that the HTC network has done in the past in supporting the Unite for Bleeding Disorders WALK program. So as you will see here, we had 23 HTC teams raise more than $14,000 in 2020, which is really amazing. And that's what got us thinking was, with this Harmony and Hemophilia project, how do we better connect the HTCs to their local walks and their local fundraising opportunities? What's going to get the HTCs excited and make this a really mutually beneficial partnership? Similar to what we were hearing with Bob and Glen, it's that we may have slightly different missions, but we really have the same vision of how do we partner to best serve the community. So we're really excited to dig in deep with Karan and kind of move through what this might look like. We also leaned into some HTC staff as well as some chapter staff to see what was important to them, what might they need from a resource perspective, and how we can really shape this program to be something that's going to work for everybody involved. Next slide, please, Sean. Awesome. So I don't want to steal any of Karan's thunder, so I'm going to be really brief on this slide. But really, when we think about some of our national partners that support the Unite for Bleeding Disorders WALK program, we really want to tie that back to ways that we can help local chapters raise more money to serve their communities. We want to make it mutually beneficial for our national partners. And so with the Hemophilia Alliance, that's where this idea of the Hemophilia Treatment Center Challenge was born. It was a way for, number one, to hopefully create opportunities to motivate more fundraising at the local level, but also two, can we create a collateral piece that HTC can give out to their family members, encouraging more and new friends and family teams. Takeda is aligned with that Top Team Captain Award. People have been really excited about those Converse sneakers with the blood drops that they can customize. So just thinking about elements we can add to the walk program that will get people excited and motivate and feel like they have the opportunity to be a true champion. Next slide, please. I also wanted to share that some of the elements within this HTC challenge elements are specific to the Unite for Bleeding Disorders walk, but we know that there are walks and golf tournaments and gala events and lots of amazing things that are happening that aren't associated with the Unite for Bleeding Disorders umbrella. So Karan will speak to some of those recognition pieces, but if you're an HTC and you're affiliated with a chapter that's not within that Unite Walk brand, we certainly encourage you to reach out to them and see the different ways that you can connect, become local champions, and really sort of have that dual face as dual partners in serving our community. With that being said, next slide. And I will turn it back over to Karan to talk about some of the specifics with the HTC challenge. So appreciate you hanging on, and we can certainly answer questions at the end.
Katie, thank you so much. Sean, I think you can go, yeah, you can go to the next slide, actually. Thanks so much. Thanks again, Katie, for speeding through that. You're speed talking. I appreciate that. And thanks to you guys that have hung on to hear this. Just wanted to review quickly Harmony and Hemophilia. The goal is aimed at enhancing the relationship between member HTCs, NHF chapters, and HFA or member organizations. We realize that a lot of chapters have great relationships with their HTCs, but then there are some that are not so much. So we'd really like to make sure that we are helping to enhance those relationships, as well as make sure that the HTCs are aware of all the programs that the chapters and the HFA organization team members have to offer the hemophilia community. Next slide. And in keeping with that goal of enhancing relationships, we have launched the 2021 HTC Wall of Walkers Challenge, to where we are going to challenge HTCs to increase their participation in the NHF Unite Walks program. According to reports that we've gotten from NHF, there are about, I think Katie just said there are 23 HTCs, but we have 108 member HTCs, so we've got a lot of room for improvement there. We're going to have 5 qualification categories, and there'll be one winner in each category based on the funds raised. The categories are going to be designed so we're not limiting our, we're not skewing the size of the HTC over a larger HTC over a smaller HTC. Once we are finished with the walks for 2021, NHF will award a $1,000 travel grant to the HTCs that is the winner in each category. That travel grant will be for attendance at the 2022 Bleeding Disorders Conference. And I wanted to mention that we did this presentation to our HTC members back in February, and as a result of a survey that we did, we became aware that in creating this program and launching this, we overlooked the fact that there are chapters that sponsor walks that are not associated with the NHF Unite Walks program. And we certainly want to make sure that we're recognizing those. We are now in discussions as to how we're going to recognize those, because we want to be inclusive as we try to increase HTC participation with all of the walks. So stay tuned. We will be sending out more information on how we're going to recognize those walks that are not associated with the NHF Unite Walks program.
Karan, your timing is excellent. My dear friend Fran Haynes from the Hemophilia Foundation of Greater Florida.
Hi, Fran.
She just asked that question, so your timing was perfect.
Well, good. And, you know, we certainly didn't want to put that at the end of the presentation, but we realized pretty early on, we heard feedback pretty quickly that, hey, we're overlooking a percentage of the walk. So we certainly will make sure that we rectify that. Fran, thanks for your question. So I realize that we've really gone over our time, and I thank you so much for everyone that has attended this evening. And this presentation has been recorded, so any of your friends or colleagues that have not been able to attend this evening, they will be able to catch that on our Hemophilia Alliance website. So, Sean, anything I missed?
No, thank you so much, Karan. Just to elaborate a little bit more on this presentation, we will send the link out to all the people that have registered and attended this program, so you will have access to it immediately. Well, I shouldn't say immediately, we'll have it ready tomorrow. And we will post it on the Hemophilia Alliance website, and it will be on the homepage, so it'll be under events. And at any time, if you have questions regarding that, please let us know. Reach out to myself, to Karan, anyone on our team, and we will be able to help you with this.
Thanks, Sean. And thank you, everyone. I hope you all have a great evening. Take care.